If you've been approved for Social Security disability, you probably think you're immediately going to get health care. You're going to get Medicare. It doesn't work that way. You're like, but I can't work. We've already determined that. It took me a long time, on average 2 years or more, to prove to the judge that I can't work and I don't have any money. So how am I supposed to pay for my health care? Don't kill the messenger. I'm just telling you the law. And the law didn't used to allow for you to get Social Security disability at all. When they started off with Social Security in the 30s, it was only for the old aged. That's what they called them. So in the 70s, they made it so you could get disability. You could get your retirement money early due to disability. But when they were fighting, the Democrats and the Republicans were fighting and saying, how are we going to pay for this? The compromise they came to was, we'll make them wait 2 years to get Medicare. So that's just it. It was just a political decision, a compromise. So you're like, well, I don't really care about the backstory. What am I supposed to do? It takes 2 years. You have to be on disability, the vast majority of people, 25 months before they will automatically enroll you into Medicare. So what am I supposed to do for those 2 years? If you don't have health insurance through your spouse or through the VA or a union, you got to buy your own private health insurance for under 65, which is called Affordable Care Act. Those of you that have watched many of my videos know that I choke on the word Affordable Care Act because it is not affordable for most people. And most people call it Obamacare. They know it as Obamacare. It can be branded different names based on your state. They call it different names in the state. But any health insurance that is private, that is under the age of 65 in our country since 2010 is Obamacare. It's ACA, Affordable Care Act. And it's not free. Based on your income, you might have a very heavy subsidy tax credit from the government, so it'd be almost free or cheap. But the average person is going to pay hundreds of dollars a month. So I like to just throw it out there. If you're 62, it's going to be over $700 a month. I know. So that's a real burden for people that are on disability that have to make it for those 2 years, that don't have the ability to be on their spouse's plan, or they're a vet and they could go on VA care. So if your income's very low, you might qualify for assistance. But if not, you're going to go to Obamacare. Yes, we can help you with that at the Medicare Family. On our website, there is a little yellow box. Go to the MedicareFamily.com, click on the yellow box, book on your appointment, book your own appointment, and we can help you price out what health insurance is going to be until Medicare kicks in. Now, Medicare will kick in automatically. And, that is, I don't get a lot of things that are good, positive to talk about, but that is a convenience. You don't have to, where do I sign up? When do I sign up? How do I do this? They will automatically enroll you into Medicare A and B in your 25th month. Now, there are people, like I just said, maybe she had health insurance through her spouse. They don't want Medicare because she's got health insurance through her spouse, which is better than Medicare, lower deductible, lower copays, more extras, and I don't want Medicare. That's fine. You won't have a penalty. There's no negative. As long as that health insurance plan has over 20 lives, you are exempt from being forced into Medicare. And if they automatically enrolled you, then you have to call Social Security and say, hey, we got to do an undo here. I don't want Medicare right now. But for the vast majority of people, it's convenient that I'm automatically put on Medicare. But the people that are disabled, they really kind of fall through the cracks in our system. And how many people are we talking about? Is this a small percentage? No. This is like 13% of people on Social Security. So of the 60-some million people on Social Security, about 13% are on disability. And they're expecting, especially with long COVID and the fallout from COVID, for that to grow to be 1 in 5 Americans. So it's a huge amount of people that are on Social Security disability. Lots and lots of people in the backlog trying to get approved for Social Security disability. And that's a really hard fight to get through to get approved. And then you assume, wrongly, that Medicare starts immediately and that it's free. So one, you got a 2-year wait, and most people have to pay for it. The third assumption is that there's no possible way they would tax my Social Security disability, is there? Yeah, a lot of people will also have to pay federal income taxes on some or part of their disability payment. Some have to pay state as well. So those are 3 what? Super bad I gotchas. But wait, like the Ginsu knives, there's more bad news to come. When you do get approved for Medicare, so you've waited your 2 years and you're like, thank God, now I'm on Medicare. You don't want only Medicare A and B. It's not enough. There's too many holes in original Medicare, what you can get from the government. You should buy supplemental coverage. And you have lots of choices dependent upon your state. Very much dependent upon your state. If you are in most states, you cannot buy a Medicare Supplement Plan G. And that's what you want in most cases if you're disabled, because you have a lot of chronic conditions, expensive health conditions. A Medicare Supplement Plan G has the least out-of-pocket costs. So it's the Cadillac of supplemental care. But most states do not require the insurance companies to sell it to people under 65. Indiana, Ohio, Kentucky, Tennessee, Georgia, South Carolina, North Carolina, most states, especially most of the states in the middle of the country, don't require it. Now, if you're lucky enough to live in New York or Florida, you see what I'm going with, that type of state government, yeah, you can get a Medicare Supplement Plan G, and you want to. Now, when you call our office to book an appointment and we are explaining all this to you, we'll go into more in-depth with you why, even though it costs more, a Medicare supplement could end up costing you less based on your health conditions. How often you're seeing a doctor, you're a specialist, how often you're going out of your state. So if you need help figuring this all out, go to our website, themedicarefamily.com. There is a yellow box. You can book your own appointment. We're licensed in all 50 states. You do not pay for our services. We're independent contractors for over 62 different insurance companies. They pay us if we help you with the plan. So there's no cost or obligation. Call us, bounce your questions off us, and see if we can help you in your state. Like I said, it's very much dependent on your state. In most states, if you go on Medicare and you're under age 65, your only choice is private Medicare Advantage plans, PPO and HMO plans, where you have a select list of doctors and a network of hospitals that you have to see. And I'm not saying that that's a bad option. It's just if you're on disability, a lot of times a Medicare supplement is a better option because there's less out-of-pocket costs. But like I said, most states don't require the insurance company to sell plans to people under 65. So when you get ready to turn 65, it is a very important window where you get to get a Medicare supplement plan regardless of your health. I'm going to say that again. Regardless of your disability and the fact that you might have very severe health conditions that you've had for 10, 20 years. You've been on disability for a long time. But when you turn 65, you're just like every other American that's turning 65. You're going to be able to buy any plan, Medicare supplement, from any company. You want to get the best G in your zip code, we'll help you with that, regardless of your health. So it's a window around when you turn 65. And if you mess that up, it's never going to come around again. You're never going to be able to get that because anytime past that window, you'd have to answer the health questions. You most likely would not be able to because of your disability. So it's very important that you understand these rules when you're disabled because there's not a lot of people beating down your door trying to explain it to you. It's hard to find this information. Now, there's a lot more that goes into being on Medicare and disability. And some of it is just making sure you don't lose your disability. Took a long time to get it. Easy to lose it though. There is a limit of how much you can make on disability. Now in 2023, that amount is about $1,400 a month, gross income. That amount does go up every year. So we have a Social Security and Medicare cheat sheet. It's on our website, themedicarefamily.com, that will have the updated amounts for each year. Now, you are kind of loosey-goosey with this amount, and you are earning, a little bit over that every month. The government's not really going to care, right? The government does care. If you earn over that amount, about $1,400 of gross income a month for 9 months, they just kick you off disability. Gone, baby, gone. So good luck getting that back. And you knew how hard it was to get it to begin with. So be very conscientious about the earned income limit when you're on Social Security disability. It is monthly, gross monthly income. They're not going to say annually, this is how much you make. It's per month. Do not go over that. Now, a lot of people say, I can't live on this. I have to go over it. Okay, there's a special program called the Ticket to Work program. And where Social Security allows, you got to talk to them. You got to work with the Social Security Administration, where they allow you to go back to work and keep your Social Security and keep your Medicare. Ka-ching, ching, very important here. And if you can go back to work, then you'll go off disability. But this is the big part. You get to keep your Medicare. You can keep it for up to 96 months. I know, it seems like a weird random number. As long as you still have your disabling condition, but you are able to work, you can keep your Medicare. And that is a huge deal right there. That is why you don't just want to say, forget disability, I'm just going back to work. You want to work through the program that Social Security has established, work with them, do it their way, so you can keep your Medicare insurance. Critical. Now, just a couple odds and ends for people that are on disability, because you know how hard it was to get it. So you're nervous about anything. And people are always saying, can I get married? I heard I can't get married. You can get married. Get married. To keep your Social Security disability, you have to remain disabled. You have to remain with that disabling condition. And you have to stay under that earnings limit. But you can get married. Marry a millionaire. Inherit money. People always say, I just inherited money. Am I going to lose disability? No. Are you still disabled? Are you earning under that limit? Yeah. I hope you inherit money. I hope you marry a millionaire. They don't check your bank account. They don't see how much stocks and bonds and how well everything's performing. Are you disabled? Are you earning under that limit? So that gives a lot of people a relief, because they want to be able to live their life. They want to be able to get married. They want to be able to do things, and they're living in fear of losing their disability. So that is a few of the good things I have for you. But the bad thing that I did allude to earlier is that, you might have to pay taxes, especially if you marry the millionaire. Now, the inheritance is not taxable, but once you do something with it, then that could become a taxable asset. So what do we mean taxes? If you are on Social Security disability and you're single, and all your sources of income, including your Social Security, are under $25,000, you do not have to pay federal income taxes to the IRS. Well, it's kind of good news, but it's bad news because you're not living on very much money. Now, if you make over $25,000 but under $34,000, they will tax half of your disability at your income tax bracket. If you make over $34,000, they will tax 85%. I know. I can hear you. I can hear you out there watching this. Yes, that does not seem fair. I agree with you. Now, if you're married, there's different brackets, and I have that on my Social Security and Medicare cheat sheet. Again, go to our website, themedicarefamily.com. Go get the cheat sheet. It's easier to read these brackets than for me to tell you all the married and the single ones. I will tell you this, they don't change every year. So they're not going up and keeping pace with inflation. So more and more people are having their Social Security, retirement, and disability taxed every year. Right now, it's about 55% of all people have their Social Security taxed. So I hope that you learned something about Social Security and Medicare, because it's critical that you take this bull by the horns, because there's not many people out there that understand it. Oftentimes your insurance agents don't understand it. Oftentimes your CPA doesn't understand it. Your financial planner, your elder law attorney. Nobody really understands it. Everybody understands their lane, and all these things intersect. And if you don't understand what's going to go on, you might miss your enrollment window. And then, like I said before, it's gone, baby, gone. You can't appeal it. When you're getting ready to turn 65, we want you to call us 3 months before you turn 65 if you've already been on Medicare due to disability. If you've been on disability for 22 months, that's when we want you to call us before it kicks in, because it's going to kick in your 25th month. So we can help you research and see what plans are available in your state. Like I said, you might be in a good state like Florida or New York, or you might be in the rest of the country where we don't have the option to get you a Medicare supplement. And most importantly is your drug coverage. So if you are on Social Security disability, after that 25th month, the government automatically enrolls you in Medicare A and B. But what about your drug plan? No, the drug plans are all through private insurance companies. You have to work with somebody like us, private insurance specialists. The government can't enroll you in it, and it doesn't happen automatically. So if you don't do anything and you're just sitting around waiting for it to happen, all of a sudden you've missed your window and now you are late to get Medicare Part D drug coverage, which is critical. And if you're late, you might have heard there are penalties for being late. Unfortunately, a lot of people on disability fall into that crack and they get hit with those penalties. The good news, and I love to end this video on a good note, is that when you do turn 65, if you do have those late penalties, the government gives you a redo. It wipes your slate of those penalties and you start over fresh, just like everybody else that's just turning 65, just going on Medicare for the first time. So if you're on disability and you have more questions, go to our website, book an appointment with our specialists. We are licensed in all 50 states. We will love to help you explain more about your situation and most importantly, tell you what's going on with the state you live in and how it treats insurance for people under 65. Thanks for watching. If you like this video, you might really like this video. Check it out. And we'd appreciate if you subscribe to our channel so you never miss a great video. We put out one every week. Check in the description below this video for a link to our cheat sheet on Social Security and Medicare. And you can also give us a comment if you have a specific question. Always feel free to call us or email us at the Medicare Family.